All right, we're now recording. So today's Women in Ag Wednesday webinar is on healthcare in your senior years. You can see the upcoming ones. We actually have them scheduled all the way through December. And the blue link here, you can find our upcoming webinars or previously recorded webinars. So we're recording. We will have these slides available on the website and send a link out following this webinar. We'd like to thank our sponsors and collaborators of the Women in Agriculture program. With that, I'm going to go ahead and turn the presentation and the day over to Maria and Jesse. They'll be speaking today on healthcare for your senior years. So Maria and Jesse, thanks so much for being here today.
Thank you, Shannon. This is Maria Pepitas, and I'm with University of Delaware Cooperative Extension, and I'm really pleased to be here with you today to present one of our Smart Choice, Smart Use health insurance programs called Health Insurance in Your Senior Years, Medicare, and Other Options. My co-presenter today is Jesse Ketterman, and I'll let him just introduce himself.
Hello, my name is Jesse Ketterman. I'm an extension educator with Family and Consumer Sciences. I'm in the Western Cluster of Maryland, and I'm glad you could join us today.
Thank you, Jesse. And as I said, I'm Maria Pepitas, and I work with UD Cooperative Extension, and I am an extension educator in Family and Consumer Sciences with a focus on financial management. Jesse and I have been working on health insurance education for the last few years, and we're really pleased to present this new program to you. So to kind of start us off, we'd actually like some feedback from you. And so Jesse is going to post in the chat a URL, and we would hope that you would take a few moments and fill out this survey. And it will take you to a new URL, and we're asking you to do a pre-survey, and then at the end, we'll do a post-survey. So don't don't close the window once you open it, because we'll be asking you to go back and put information in, do the post-test, basically. So we ask for this information just so that we can improve our program and be able to tell a wonderful story about the impact of our programming. Everything is held confidential. I believe that Jesse or Shannon sent out the informed consent document. That was one of the items that we sent to you previously. So if you don't mind taking a few moments and doing that.
And Maria, I mentioned that the link in the chat box or the one on the screen will work. The one on the screen is kind of a short, abbreviated link, where the link I posted in the chat box is the longer.
Okay, great. Thank you. So if you finish the survey, just write in the chat, yep, I'm back, or something like that, and then I'll know we can move on. Okay, so our plan for today is really to help you understand what you need to know about healthcare costs in your senior years and get a better understanding of where to go for information about Medicare and supplemental health insurance policies. review strategies and tools to help you estimate healthcare costs, and identify options that are within these plans to help cover long-term care costs. And in the chat, if there are specific questions that you might have, please let us know so that we can kind of tailor our comments to help answer those questions as we go along. So the way we organize sort of the presentation today is by these questions, right? So there's key questions that we need to answer, and we kind of frame them from the why, what, and how perspective. So on the why side, you know, why do I need to plan for healthcare after 65? That's our why question. Our what questions are, what is Medicare and what does it cover? What are other insurance options and what documents provide information? And then the how is, how do I estimate healthcare costs and how do I cover long-term care issues? And if you know and can answer all these questions, then we think that you're really able to make smart use of your health insurance. So we're going to start with the first why question, right? Why do I even need to plan for health care after age 65? So take a second and jot in the chat why you think you need to be planning for this. So thank you for that. Let's see. We've got some answers. Everyone will be 65 sometime. That's true. And medical situations can change over time. And certainly we know that as we age, our healthcare needs may change, right? So understanding Medicare options and supplemental options, yeah, it can be really confusing, and we're really going to be about helping to reduce confusion today. So here are some of the things that myself and our team have come up with in terms of why you might need to plan for healthcare after the age of 65. And certainly part of it is to ensure that you have coverage as you the coverage that you need as you age. And as many of us retire, some of our healthcare coverage may go away, right? If our employer is not offering it anymore, for example. And so we may need to be thinking about that transition to when we turn 65. You certainly want to understand what your plan covers, and so that you can access all the benefits in a way that is going to really help keep you healthy. And so to kind of get the most out of your plan is a reason why you need to understand Medicare and some of the other healthcare plans available to you. You want to try and understand the costs, right? So some of those out-of-pocket costs will change from the kinds of plans that we may have had prior to 65. And one of the things that we will review today is a little bit what some of those out-of-pocket expenses may be. And so you want to have money. You want to plan for those out-of-pocket expenses so you have the money when you need it, so you can access the care that you need. And lastly, you know, every year there is a time for re-enrollment in the Medicare supplement plans. And so you want to be able to kind of keep an eye on the plan that you've chosen and make sure that it continues to fit your needs, both from a healthcare perspective, but also from a financial perspective. So let's first talk about what Medicare is and what it does cover. So Medicare is a government-sponsored healthcare program that is available to people 65 and older. It is offered in kind of several parts, and we'll talk a little bit about those several parts. The health insurance itself is actually offered through private companies. It's just organized and underwritten through the Medicare program. So, as I mentioned, there are 4 parts to Medicare, and this is one of the places it gets a little confusing. So, Part A provides inpatient hospital coverage. So this is really the part of Medicare that when you go to the hospital, it covers those costs or some of those costs. Part B covers sort of all the other things, all the outpatient, medical, maybe devices, it may be in-home care, it may be lab work, those kinds of things. But all those other types of things that are not affiliated with being in the hospital. Part C offers an alternative way to receive your Medicare benefits, and we're going to talk a little bit about that in a minute. And then Part D, that is the prescription drug coverage plan. And so typically you're choosing a Part A, a Part B, and a Part D as part of your Medicare coverage. And then the alternative would be to choose a Part C. It's usually either or. And you'll understand why in just a minute. We're going to play a little video now to kind of give kind of an overview of Medicare. I think we are.
Yes, we will. I just need to upload it, so give me a minute, please.
Okay.
Maria, I need you to pass me the ball, and I can do that.
All right, you got it. Done.
Great. And so everyone should be seeing the video now. So I hope you found that video informative. Again, it provides a good overview of the various parts of Medicare. And so now we're going to transition to what does Medicare cost? And I'm going to post a link in the chat area that includes the information I have on the screen here. So you don't need to go to this link. I'm just providing it to you as a resource. This information was also uploaded on the website, so you would have it before the webinar today. But as you can see on screen, premium, Part A premium, most people don't pay a premium with Part A. Sometimes it's called the premium-free Part A. If you do have to buy Part A, it's going to depend upon whether you contributed to your Medicare taxes and how long you did that. So you can see a couple qualifiers there in that particular section. Under the Part A hospital inpatient deductible and coinsurance, you can see there's a $1,408 deductible for each benefit period. And so the benefit period is, if you went to the hospital, it'd be that period of time that you were in the hospital. So it's for each benefit. Now that can, if you were out of the hospital for 3 days and you go back in for the same event, that's all part of one benefit period. But essentially, there's a deductible for each time you use the insurance, as they define it as a benefit period. And then you can see that coinsurance takes in as you move along. So there's zero coinsurance the first 60 days, 61 to 90. There's a $352 coinsurance, and then it increases after 91 days. Part B premium, there is a standard premium of $144.60 with the Part B premium. And again, that can go up if you fall into those other income categories, and that information is available at the link I provided and also in the materials we gave you. The Part B deductible, $198. After your deductible is met, you typically pay 20% of the services after that. Part C premium is going to vary by the individual plan that you have signed up for. And then Part D premium is also based upon the plan that you have signed up for. So that's going to vary depending upon which plans you select at the time. So what are the important dates? There's essentially 3 times that you can sign up for Medicare: the initial enrollment period, a special enrollment period, and the general enrollment period. And you can visit Medicare.gov or meet with your local state health insurance assistance program representative to discuss your particular situation. But for most people, it's 3 months before you turn 65 until 3 months after you turn 65. So there's a window there that when you can initially sign up. And then once you're enrolled, every October 1st, you can begin the process of comparing plans for the following year. That information will be on the Medicare website. And then the open enrollment period is October 15th to December 17th. And then January 1st is when your new coverage would begin. So what is Medicare Part C or Medicare Advantage plans? Basically, they are similar to HMOs or PPOs, depending upon the plan you pick. They're often cheaper when you take Medicare and include a supplemental plan with the Medicare. And you can switch from this plan back to Medicare during an open enrollment period if you change your mind. So all the Advantage plans or the Part C plans include all the services and benefits covered under Part A and Part B. A lot of them include the prescription drug coverage, which is referred to as Part D. And they're also ran by Medicare-approved private insurance companies, which the rules are set forth by Medicare. And all the plans have a yearly limit on your out-of-pocket costs for medical services. And they may include extra benefits that aren't a part of the original Medicare. And of course, anytime they offer more, it's likely going to have an increased cost to it. So what are your other insurance options? Let's talk about that for a minute. and I'm going to turn it over to Maria for that discussion.
So thanks, Jesse. So what are my other insurance options? And in the video, I talked about insurance policies that sort of wrap around Medicare. And so they kind of go by two terms: Medigap policies, right, covering the gaps of what Medicare doesn't, or supplemental policies. So they're used, those words are used interchangeably. But they are additional policies that we pay for, there's a premium to, that then wrap around and supplement the Medicare original plan. So not the Part C plans, not the Medicare Advantage plans, just the Medicare original plan. So that would be Part A, Part B, and Part D. Well, really Part A and Part B. And so it really depends on the plan, you know, how much it kind of wraparounds and picks up those extra costs. And so there are standardized plan types out there, and we'll talk about those in just a moment. But it helps then us understand if you're trying to comparison shop across plans, we can easily look at similar plans. And it'll become a little bit more apparent in a moment. But those Medicare supplement plans or Medigap plans offer different kinds of plans. And so there are preferred provider organization type plans, exclusive provider organization plans, and health maintenance organization plans. And so these are sort of similar to the ones that we might be used to kind of pre-age 65 in terms of the way they're structured. So there are PPO plans, EPO plans, and HMO plans offered as part of these standardized supplemental plans. And so what kind of plans are offered depends on the insurance company and what they are offering. And so let's just talk about what these standardized plans offer. And so these plan types, you can see across the top A, B, C, D, F, G, K, L, M, N. Those are the types of plans. Along the left-hand column then, it begins to articulate the different services that may be covered or not covered under those plans, and then by how much that plan may cover that item. So you can see for all of the plans, A through N, all of them will cover Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up. So as an example, Jesse was sharing that most of the co-insurance, for example, for hospitalization coverage in Part A is the insurance company covers 80%, and we would be responsible for 20%. That's under Medicare. If you choose a Medigap plan, no matter which one, A through N, they are going to cover that 20%. So that's an example of how to interpret that first row of the chart here. So in Part B, we noticed that there is also a coinsurance or copayment, and you can see for plans A, B, C, D, F, and G, those types of Medicare Medigap plans, will cover all of that costs, whereas K and L only cover a percentage of those costs. So if you look down further on this list, say for example, skilled nursing care coinsurance. Now you can see plans A and B don't cover that. but plan C, D, F, G, M, and N will cover that, and K and L will cover that, a certain percentage of that. So you can begin to see that by understanding what type of Medigap plan you're looking at, you can then determine which one you might need depending on your healthcare situation and also what you would like to have, covered, and also your finances, right? Because no surprise here, the more coverage a plan provides, the more expensive it may be. So the website where you can find this chart, right, is listed here on the slide. And the other piece that's important to know is when you go to the Medicare.gov website and put in your information or start an account, it is actually a very user-friendly website, and you can put in information about which of these types of plans you might be interested in comparison shopping around, and it will generate for you the options for you in your area. Not all plans are available in all areas. So what's nice about this is the Medicare website is that it will help you do some of that comparison shopping. It does the same thing for the prescription drug policy, which would be a separate policy. So the Medigap supplemental plans really are the things that wrap around Part A and Part B of Medicare. You would end up purchasing a separate prescription drug or Part D plan. And so ultimately, you might end up with 3 different premium payments. One for the drug plan, one for the Medigap or supplemental plan, and then the one that covers Part B of your Medicare plan. If that was very confusing, type in the chat and we'll try and make it clearer. So where can we find out some information, right? What documents provide information? That's one of our what questions. Certainly, information about costs can be found on the Medicare supplement or Medigap supplement insurance card. Your Medicare insurance doesn't really include information about co-payments, for example, whereas your Medigap or Medicare supplement policy will be a card that looks similar to kind of what we're used to. The name of the company, all of our, membership numbers, group numbers, and whatnot, and then costs associated with the policy. Other information about Medicare specifically can be found at the Medicare.gov website. And so, as I said before, it is a fairly user-friendly Medicare site. You can set up an account and or not. If you're age 65 and you just want to explore, you can just explore. The other place you might get cost information and also coverage information is from the company from whom you have purchased a supplemental plan, a Medicare supplement or drug plan, right? And so there should be some sort of document that comes to you that's called the evidence of coverage that will help you better understand what is covered or not covered under that plan and the costs associated with it. Okay, so how do we cover or how do we estimate healthcare costs? So we have found that some of the questions or some of the issues that come up as we've done this program is there is sort of this transition from pre-age 65 health insurance coverage versus after age 65 healthcare coverage. So prior to age 65, healthcare coverage may include sort of one premium for an entire family, plus many out-of-pocket costs. When we transition to Medicare, one of the things to know about is that each person age 65 in your household, so it'd be you and maybe your spouse, right, are going to have separate plans. So each of you will have a Medicare plan, and each of you will have, if you've chosen, a Medicare supplement and drug plan. So in essence, it sort of doubles, right, our costs, and also doubles the work in terms of doing the comparison shopping and paying attention to how we're using insurance and what that may cost. And one of the other things that can come up is for those of us who may have had an employer-based plan that we can then also use into retirement. Typically that plan is going to be a supplemental plan and will wrap around your Medicare plan. For most employers, what happens is Medicare becomes your primary insurance, and the employer-based plan becomes your wraparound. So that's a question that you need to talk with your employer about if that's an option for you. And that may also help you understand A, how it works, but also B, what the costs are. So all of that to say, it can be a little complex, but we wanted to try and make it a little easier to understand how you might estimate healthcare costs. So we came up with a case study. And so we're going to introduce Terry and his family. And one of the handouts that was emailed to you is really the information about Terry and the family. And so here's the story, right? Terry is 68 and Drew is 67, and they're a couple on the go and are relatively healthy. They both have Medicare, a prescription drug, and a supplemental medical or Medigap policy. After reviewing healthcare expenses and the explanation of benefit documents from last year, Terry noticed that there is an individual deductible for both for Part A of $1,340 and for Part B of $366 times 2, right, is $3,412. Because of the Medicare Supplement F policy, the only additional out-of-pocket expenses will be for co-payments for their medical costs. So this was just Terry's acknowledgement that, gosh, if it wasn't for his the supplemental F plan, he would be paying those deductibles. In terms of how they're using medical services, each family member visited their primary care physician 4 times, including the annual checkup. They paid $20 a copay to see their doctor for each visit. Terry determined they paid for 8 copayments or 8 visits. Drew has allergies and visits with the allergist once a year, has prescription drugs to help manage the allergy, and Drew pays $30 for the office visit once a year and $15 for prescriptions, which is a 90-day supply 4 times a year. Terry and Drew both wear glasses and go to the optometrist for a checkup and each get new glasses, and the vision copayment is $30, and their glasses cost $300 each. And they go to the dentist once a year with a copayment of $30. Terry pays a total of $268 per month for the Medicare Part B premium and $70, that's 2 times 35, for the prescription drug plan, and lastly pays $380 per month, that's 2 times 160 for the Medicare Supplement Type F policy. Terry also pays $80 a month for dental insurance premiums. So Terry has an emergency fund, but he really wants to try to set aside money to cover out-of-pocket costs. And he realizes that with the Medicare and the supplemental insurance policies, there's really no out-of-pocket maximum. And so if something really catastrophic happens, there may be additional costs involved, and there's no cap on that. Okay, so how do we get organized, right? So the case study kind of wraps around with a publication called Estimating Your Healthcare Costs, and that was another document that was shared with you. That document has a worksheet that looks something like this within that document, and what we're hoping to do then is to really fill in this document for Terry and Drew. And this is what it would look like, right? We took that story and we kind of plugged it in, and you see we have a dental premium of $80 and a Medicare premium, a prescription drug of $70 and a Medicare premium of $268, and then their supplemental policy at $380. So their total monthly fixed healthcare cost is $798. So if you multiply that by 12, it's $9,576. So that is really an out-of-pocket cost that Terry and Drew need to plan for. Then comes, so there's no deductible because the Medicare supplemental policy covers that deductible, right? And then here are some of their fixed costs their flexible costs based on how they are using healthcare services over the year. And so their total flexible healthcare costs is an additional $970. All right, so how do we determine kind of how much they need to be saving over and above premiums, right, to really help cover healthcare costs? And so in that estimating healthcare costs document, there are some boxes that kind of help do these calculations. And so in this case, we're looking at box 1, how much do I need to set aside monthly over and above my premiums to cover healthcare costs, at least known healthcare costs. And then box 3 is what's my total annual healthcare costs and can I afford this plan, right? So here we have filled in those forms based on the information from Terry's story. And so you can see he needs to be saving or setting aside an additional $81 a month to cover some of those flexible those flexible healthcare costs that are out of pocket. And then in terms of what is their total healthcare costs is $10,546 during the year. So this tool, right, this publication and this tool is something that then can be used to begin to really estimate what is my out-of-pocket cost going to be for healthcare. So we're hoping that this example can help you really better understand how you might estimate costs for yourself and help you kind of get a better sense of how you can look at how you typically use healthcare to kind of get a sense of, well, what might those additional healthcare costs may be over and above premiums. So we're hoping that this has really helped you increase your skill and ability. And if you think it has, maybe in the chat, you could just say, yeah, I think I could do this for my own self with my own situation.
So now we're going to just give four tips to managing your health care cost. And so, you know, the first thing that you want to do is you want to review your health insurance documents to understand your plan and its costs. So again, take time to know what these costs are, figure out what the premiums are, the co-payments, co-insurance, deductibles, and the out-of-pocket maximum. Then you want to be able to estimate your co-payments, prescriptions, your equipment, your travel, and other costs that would go along when you see your healthcare providers. Then you need to kind of start to calculate how much you need to set aside to cover an out-of-pocket expenses. So you want to kind of set that money aside so that you have that when it's needed. And then, of course, each year you want to kind of shop around and look and make sure that you have the plan that is right for you. So now we step into what are the key questions that you need to answer and the how in terms of how do I cover my long care term. So that's where we're jumping to now, is that long-term care. And as you can see on the screen there, long-term care is a range of services and support for your personal care needs. Most long-term care isn't medical care, right? Most of it is help with your basic personal needs of everyday life, sometimes called activities of daily living. Another term that you're going to hear when it comes to long-term care is custodial care. And again, Medicare doesn't cover long-term custodial care. So that's an important thing to know, that this long-term care is not something that is covered by Medicare. So what Medicare does cover is, Medicare does cover long-term care in the hospital. So that's usually more than one serious condition for patients who are going to improve over time and then return home. So under Medicare, you're only responsible for the one deductible for any benefit period. So if you would go to the hospital for some type of long-term care, again, that would be the benefit period there. But there is that expectation that you are going to return home and that you're making progress along the way to return home. It does cover skilled nursing care in a skilled nursing facility, but it's under certain conditions and for a limited time. So that, it all depends upon what it's for. But it is a limited period of time that it will be covered. It does cover home health services. And so that might be like intermittent skilled nursing care, physical therapy, speech language pathology services, continued occupational services, things such as that, where they would come to your home and provide services. And then it does cover hospice and respite care. So care is usually given in your home, but it may be covered in a hospice inpatient facility. So depending upon your terminal illness and related conditions, the plan of care for your hospice team creates can include a variety of services. So again, that's going to be a situation that Medicare would cover. So then how do we cover the pieces that it doesn't cover, right? So what are our long-term care options? And so you got to look at your Medicare and your Medigap supplemental insurance policies to see if they cover long-term care. There is long-term care insurance out there, and it's based on your ability to perform activities of daily living, and it's usually paid up to a certain amount each day. So it's not something that's going to cover the full cost. And again, it's similar to what Maria had said earlier. The higher that you pay with this long-term care insurance, the more it's going to cover. The less you pay, the less your coverage is going to be. Sometimes people have life insurance policies that have built-in long-term care coverage, so that might be an option that you have. You end up having to spend down your own assets to cover your long-term care. And then you have Medicaid and other state programs for limited income seniors that may also cover your long-term care options. And usually with those options, again, you can only have so much in terms of assets before you could qualify for Medicaid. So where can you find out information about Medicare and supplemental plans? We talked about this earlier. Medicare.gov is a great resource, a lot of information there that you can look up. If you have a supplemental policy health insurance provider, you can go to their website or 800 number. A lot of times you can find that on the card if you have it. Your provider for your prescription plan would also have a health insurance or an 800 number or a website that you could gather information. A great resource that we all have is what's called the Senior Health Insurance Program. It's called the SHIP. And so there's representatives in Maryland, say, in each county that you could call and sit down and have an appointment with them, and they can talk about your different health care options in your senior years. If you qualify for Medicaid, Medicaid would be another place that you can go for information. And then here's a resource for long-term care, and it's a .gov website, so you can go there and gather some more information about long-term care. So at this point, Maria and I would like to open it up to any questions you have. If you could type any questions in the chat box, and we might need Shannon's help. If you respond to host and presenter, Maria and I'll be able to see it, but if you only respond to the host, then Shannon's going to have to relay the question to us. So try to click host and presenter, and we can answer your questions. And if you don't have any questions, and then we'll keep monitoring this. If you don't have any questions, if you could go back to the survey that Maria had mentioned at the beginning, we'd like to kind of get your feedback as a post assessment. So you can open that link back up that Maria shared at the beginning and answer four quick questions for us. And we'd appreciate your feedback. With that. And then I'm also going to share our contact information. If you have any questions, you can email us directly. We'd be more than happy to answer your questions via email as well. And as we continue to give people an opportunity for questions, we just want to thank you for joining us today, and we hope you enjoyed our webinar on understanding and estimating healthcare cost in your senior years. I'm going to turn it back over to Shannon's slide because she may want to introduce our next webinar.
Yeah, can you resend the poll again? There was a question about where the poll link is.
Yes, I can do that.
Or perhaps we can put it in the chat pod.
There it is.
I'm not seeing it.
You don't see it in chat pod right now?
No. Oh, it's there. Okay, somebody said they could see it. For some reason, I can't see it.
Yeah, I can't see it either.
Weird. It must have just gone to participants. Any questions? Any other questions for Maria and Jesse? We appreciate you filling out that poll. Definitely something we try to track is just some data about the types of programs that we're offering, so we really appreciate that. Again, all the slides and handouts referenced in this presentation are going to be available with the recording, and a link will be sent out within the next 2 days, hopefully. We'll be able to get that out to everyone that had registered. So if you want to go back and reference any of the slides or questions or handouts, we'll have those available for you. All right. Any other questions? Great. Well, Maria and Jesse, thank you very much. You've spoke a number of times for us on these programs, and we just really appreciate it.